Today we're going to talk about a bruised or sore shoulder. This is something that probably maybe you fell into an object, or it could be a gradual thing to cause the soreness. Probably what's causing you to hurt, if you didn't have a traumatic event, is this subacromial bursa, as you see here. As you lift your arm away from your body, the rotator cuff tendon slides underneath this arch. And this ligament has a very sharp edge. So as that bursa slides in and out, if the bursa is inflamed, you lift your arm up in this manner, and that arc of motion is called a painful arc. That's when your bursa is sliding in and out of that area. So a bruised shoulder probably means that you've got a little bursitis in your shoulder. And if we look at the shoulder model here, you can see again, as you lift your arm away from your body and that bursa is very highly innervated, can cause you to have a problem. So treatment for a bruised or sore shoulder, ice is one thing that really is helpful at pain control in the shoulder. So ice application in the front and the back of the shoulder is very helpful, especially if you're having night pain. Obviously, if you have pain that lingers on, you need to seek medical attention. But using ice application for a bruised shoulder is important. The other thing you don't want to do is let your shoulder get stiff. So there's some stretching exercises you can do to make sure that you do full range of motion, provide full range of motion of your shoulder. One thing you can do is just clasp your fingers like this, Ross, and then put your hands behind your head in this position and let your elbows go out and back in. Okay, so you're bringing your elbows in towards each other. So you go back in and out, and that will help make sure your shoulder doesn't get stiff. Now the other stretch we can do is you can just grab your elbow with one hand and pull your arm across your chest, and that'll help restore the main motions of your shoulder. Ice application is very, very helpful with a sore shoulder. Rotator cuff function, rotator cuff strengthening is very, very important, because when you have pain in your shoulder, you have a 50% inhibition of your rotator cuff muscles. So we got to get rid of the pain and then do the rotator cuff strengthening.